widened pulse pressure. That is characteristic of increased ICP. I think I have said in pulse pressure when we have discussed in the cardiovascular system. I have been mentioned that point. Widened pulse pressure is the characteristic of increased ICP. Okay, widened pulse pressure means pulse pressure will be more than 40 mm of Hg, right? So widened pulse pressure is one of the characteristic of the increased ICP. See, the main points I said, one is hypertension with widened pulse pressure, second one is bradycardia, and third one is bradypnea. These three together is called as Cushing triad. Okay, Cushing triad. Dura mater, Raynaud mater, pia mater, there are spaces in between, in between dura and skull, epidural spaces. There the problem is. There the bleeding occurs. There the hematoma occurs. Hematoma means collection of blood. See, why it is so serious means, in epidural space, meningeal artery is there mainly. In epidural hematoma, most probably meningeal artery is damaged, and or otherwise bleeding occurs in meningeal artery. Artery means obviously it is with great pressure blood will be come out, a lot of blood can be lost, and patient may go into unconsciousness, coma and death. Understood? So that due to meningeal artery bleeding, epidural hematoma is serious one. Okay, most serious head injury, lorazepam or diazepam, especially in children. This is the drug of choice for status epilepticus. Don't get confused. Then coming to the types of seizures, mainly two types of seizures are there: generalized seizures and partial seizures. See, in generalized seizures, not only a particular area, but almost all area of the brain is involved. Almost all part of the brain's neurons are involved in generalized seizures. Then what is the difference between these generalized and partial seizures? What is special in partial seizure means, in partial seizures, only a specific area of the brain is involved. For example, temporal lobe only. Expressive aphasia means patient cannot verbally communicate, but can understand everything what others say. Okay, but patient cannot talk properly, cannot communicate properly. That is called as expressive aphasia. Okay, write down that. Damage in Broca's area of the frontal lobe, frontal brain. In receptive aphasia, where vernix area is damaged, okay, a problem is there in the vernix area, means temporoparietal lobe. Here patient can communicate verbally but cannot understand anything what others said. Even written words also patient cannot comprehend. That is called as vernix aphasia. Guillain-Barré syndrome, this myelin will get destructed, damage to this myelin sheath, myelin covering. That is the Guillain-Barré syndrome. Okay, you know, the next coming topic is multiple sclerosis. The same logic and pathophysiology there also I am going to say. The neurons, myelin sheath is damaged there also. Then what is the difference means? Mostly Guillain-Barré syndrome, in Guillain-Barré syndrome, peripheral nervous system neurons are affected and also cranial nerves. But in multiple sclerosis, central nervous system neurons are affected. That is the difference. So that there is a classic symptom here: ascending paralysis in Guillain-Barré syndrome. Usually the paralysis starts in the lower extremities, which ascend to upper area, and finally it will affect here in respiratory nerves also, which causes respiratory difficulties or even respiratory paralysis. Especially in elderly, there may be a problem with the DNA. They will get blind. They will attack against our own cells, that antibodies. Okay, they cannot differentiate between non-self and self. They will fight against self cells. They will destruct our own cells and tissues. It will cause autoimmunity. Okay, here also, so that we should suspect any infection preceded with this Guillain-Barré syndrome. Simply we should ask for some weeks back there may be some kind of infection, especially like upper respiratory infections or gastroenteritis like condition, like pharyngitis, laryngitis, tonsillitis. Especially group A, beta hemolytic streptococcus is the most commonest one which induces the autoimmunity. So that kind of infections we should suspect. Motor nerve coming into the muscle, and here there is a neurotransmitter acetylcholine. There will be receptors, cholinergic receptors. this acetylcholine is receiving with that impulses are coming into the muscle fibers, that muscle fibers constrict and we are moving it. Okay, so here the problem is in therein, that area is called as neuromuscular junction. This is the problem of a neuromuscular, simply we will call it as neuromuscular junction disorder, myasthenia gravis, mainly due to deficiency of acetylcholine. If the patient is improving, means the patient was having this myasthenic crisis, because there was substantial deficiency of the acetylcholine that hard leads to myasthenic crisis. If you are replacing it, the patient will improve. Simple logic. Then if the patient had cholinergic crisis, means after giving your dose enterophonium, the symptoms may get deteriorated, may get worsened. Immediately what you should do? Stop the medication and give an antidote, atropine sulfate. From the nasopharynx, there is a connection to the ear, okay, that you stick into, okay. So that in children's, in first the infection may start with upper respiratory, okay, upper respiratory infection. It may affect or it may spread to middle ear, otitis media. From there, it may access to, from the middle ear, it may go into, from the ear, it may go into the brain, meningitis. Simply upper respiratory infection, otitis media, which may complicate with the meningitis. Meningitis, the gold standard test or diagnostic test is CSF analysis through lumbar puncture. Sometimes they may not give CSF analysis. Lumbar puncture may be given. You can select it. Okay. CSF analysis through which the specific organism can be identified. Okay, through CSF culture. Now, our DHA, HAD, MOH, Prometric, NLEXR and NHRA crash course is also available in English. You can attend the free demo class by downloading the Nursingflix lectures app from Playstore.